Good afternoon, everyone. Myself, Dr. Kirti Chhabra, Assistant Professor, BPT Department, RPIIMS. Today, I'm going to tell you about how to check the tightness of piriformis muscle. So, for that, we have the piriformis test, and in about 15% of the population, the sciatic nerve ole or in part passes through the piriformis muscle rather than below it. It is these people who are more likely to suffer from relatively rare condition, that is the piriformis syndrome. So inpatient would be in the sideline position, and the test leg would be the upper on the upper side, and the patient flexes the test hip to 60° with knee flexed. Then examiner stabilizes the hip with one hand and applies the downward pressure to the knee. If the piriformis muscle is tight, the pain is elicited in the muscle. If the piriformis muscle is pinching the sciatic nerve, the pain result in the buttock. Sciatica may be experienced by the patient. Resisted medial rotation of hip with the muscle on stretch can cause the same sciatica. So, in this way, we can do this piriformis test. So now next we have the Thomas test for the hip flexor contracture or tightness. So mainly we have the hip flexors, basically ilios vas we have. The patient lies supine with examiner check for any excessive lordosis which is usually present with the tight hip flexors. The examiner flexes one of the patient hip, bringing the knee to chest to flatten out that and to stabilize the pelvis. So now the patient hold the flexed hip against the chest. If there is no flexion contracture, the hip being tested will remain on the examining table. If there is contracture, then the straight leg rises off the table and muscle stretch and feel will be felt, and the angle of contracture we can measure. If the lower limb is pushed down onto the table, the patient may exhibit an increased lordosis again. These results also indicate a positive test. When doing the test, if measurements are taken, the examiner must be sure the restriction is in the hip, not the pelvis or lumbar spine. And if the leg doesn't lift off the table but abducts as other leg is flexed to the chest, it is called J sign or stroke. It is indicated of also a tight IT band on the extended leg side. IT means that is the iliotibial band. So in this way we can test. So in the second figure, like if the straight leg, if there is flexion or it raises above the examining table, then we can say the hip flexors are tight, or if it abducts means it moves outward from the examining table, it means the hip abductors, mainly the iliotibial band, is tight. Thank you.